I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. This video is to help you differentiate between whether or not you're experiencing low back pain or hip osteoarthritis, which is degenerative joint disease in your hip. Low back pain can have many different causes, and the goal of the chiropractic physician is to identify the main pain generators and then manage the patient accordingly. We're gonna do a history on you when you come in. We'll do an evaluation and maybe even do an X-ray to help determine what is causing this pain that you're experiencing. When the patient first comes in, the biggest part of this, the biggest chunk, is just getting that history done, just asking questions, really. We're going to ask all sorts of different things, like we're trying to find out if there's been any old injuries, such as slip and falls or sports injuries that date back to even high school, motor vehicle accidents as well. There could be a family history, genetic risk for osteoarthritis in certain areas. We'll also inquire about your current physical activity level and how well, if you are doing any sort of exercises, how well your body is tolerating these exercises. We'll return to the primary complaint history, where we'll ask about the location of where the pain is. We'll ask about the quality of the pain. How did this pain start? Was there a certain action that took place and you're like, now all of a sudden I can feel it? What day it started, noticeable changes. You're getting the idea, basically like increase or decrease in pain throughout the day, radiation patterns, whether the pain's traveling anywhere or just staying in one spot, and the severity level, the pain level, on a 0 to 10 scale, 0 being no pain and 10 being the worst pain. Now, some patients come in, they say, I have low back pain, and they can be pointing anywhere from their lower rib to the hip area. So in other words, everyone's kind of interpreting their low back pain differently. Differentiating between low back pain and hip pain is very important to do. You don't want to be treating someone's low back when really there's a problem with their hip and vice versa. But pain can be in different spots once again, and pain location can even vary between hip pain and low back pain. It could be anywhere in the pelvic region, including the groin, which is the most common. There could be the side of the pelvis, maybe into the buttocks, the sacrum, which is that tailbone area, and the low back. To make it even more complicated, discs can even be involved with this stuff. So now you're looking at multiple different conditions all at once, trying to figure out what's going on. The other stuff we're going to do in the office when you come in and get treated is we'll look at some orthopedic tests to differential diagnose the condition. Osteoarthritis of the hip is going to be a little more painful with hip rotation, and it's going to be a little more tight. The ultimate test, whether or not you have hip degeneration or just more uncomplicated low back pain, is an X-ray that will reveal a decrease in the joint space in the hip itself. How is the most often way that hip osteoarthritis is found? Well, what they found in a recent article after reviewing 2,000 patient files and 1,000 X-rays of patients 40 or older, 19%, about 1 out of 5, demonstrated X-ray findings of hip osteoarthritis. Now that's a lot of people. In chiropractic management, what we're going to do for you if you do have hip osteoarthritis is we're going to mobilize that joint. Just mobility in general is going to help prevent the joint from getting worse. As far as degenerative processes go, manipulation, using our hands to get some pops and cracks into certain areas to help movement as well, accelerate into the area, stretching the muscles around the joint, doing some sort of leg length correction, which would require some sort of a heel lift in your shoe. Foot orthotics in the similar vein there can also help with some hip pain, because when you're walking a certain way or standing a certain way, it can cause your hip to kind of move inwards. We use PT modalities as well, physical therapy modalities, exercise, stretch instructions, and home care things, nutritional strategies, and there's even more stuff that chiropractors do. All over the board, really, we're taking care of everything. So if and when the time comes, I can help you find someone that will help you with your pain if you're out of town, or if you wanted to come to see my office, you can go ahead and give me a call. Thank you so much for watching. I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. I wanted to mention one more quick thing too about chiropractic too, is when we're doing the treatment that I just recommended there, if none of that even works, what we do next, the good chiropractor, I'm going to do this, a lot of other chiropractors I know I'm going to do this, we're going to refer you to the right person so that you can get surgery if you do need surgery. But my biggest thing I want you to take away from this is when you go to a chiropractor, we're going to do a more safe, less invasive approach. Try that out first. If that works, awesome. Now you never needed surgery, rather than just jumping right into surgery from the get-go. Thank you so much for watching. I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. Have a good rest of your day. Bye.